And really our focus is to share this knowledge and empower patients, guardians, health workers, and health institutions, because we feel that it is by doing this, empowering them with the knowledge, we will be able to reduce some of the delay in diagnosis, misdiagnosis, or mismanagement that happens. I share this quote from Chinua Achebe about seasons. And in my home country, the main seasons we know are the dry season, rainy season, hot season, or cold season. But I was speaking to a colleague earlier today, and I was telling them that it's good to dress up for the season you're in, because failure to do so can be very detrimental. So Chinua Achebe said that even the village rainmaker no longer claimed to be able to intervene. He could not stop the rain now, just as he would not attempt to start it in the heart of the dry season without serious danger to his own health. That recognizing the season we are in and being ready for that season is critical to survive that season, right? Without lamenting too much. And we all face different seasons in life, so maybe embrace the various seasons we encounter. I'll begin my talk with a story of a young girl I met who came from the northern frontiers of my home country, Kenya, near the border of Kenya and Somalia. And for about 1 year, she had this right knee pain and knee swelling. And they had gone to several local hospitals in their home area, really trying to get help. But the swelling and the knee pain was progressively worsening to the point that she couldn't straighten it. So in medicine, we call that having a flexion contracture. It was in a fixed bent position. And the last healthcare worker she saw in her locality proposed that the only solution for her was to have her leg amputated. And she was 6 years old. But the father was determined to save the leg of his daughter. And he traveled for about 2 days to a mission hospital near our capital, Nairobi, in a town called Kijabe. And when the doctors in Kijabe saw her, they felt they were not in a position to assist. And so she was then referred to a healthcare facility. And at the end of this presentation, I will share with you what eventually happened to this young 5-year-old girl. And so the objective of today's session is just really to give an overview of some of our upcoming programs, to share with you what we are offering to empower the community and the society, and that we can partner with all of you in our mission to ensure our children with arthritis and any other associated disease really prosper in their communities. And this will be the outline. I will be looking at our context here, understanding what our circumstances are, and sharing with you the needs of our community. And here I'll be focusing on Kenya because this is the research work that I've done in my home country. And just to show you that what we are proposing at Hope Arthritis is coming up because of the demand from the community, the demand from the Kenyan people. And that takes us to the third point, solutions for the people by the people. After that, we'll have questions and we can summarize. So really, what is our context? As I said, this is going to be focused a lot on Kenya. I'll shed some insight also across Africa. And context is important because only then can we really find solutions that are sustainable and feasible and acceptable by the people. And this is the reality for many of the countries across Africa, that there's been a lot of emphasis, focus on infectious diseases, and rightfully so, because these have to a huge proportion of young people and children dying early. So it's understandable. And the reality is we haven't won the war against these infectious diseases. It's still something we're battling with. We haven't conquered malaria, we haven't conquered TB, we haven't conquered HIV. But the reality is that the non-communicable diseases like diabetes and hypertension and cancer and arthritis are not waiting for us to win against the infectious diseases. And so as we continue focusing on winning and conquering all these infections that are claiming many lives, it's important that we don't turn a blind eye to the other conditions, chronic lifelong conditions like the cancers, diabetes, hypertension, and arthritis and lupus. But even as we are focusing, it's important that we prioritize our care. Because, for example, what will work for me in Kenya might not work for my colleague, Dr. Alexandra, in Rwanda. It might not work for my sister, Dr. Ayodele, in Nigeria. So whatever solutions we're coming up with, it's important we prioritize it based on our context. And as much as the COVID pandemic was very tragic, it opened our eyes to opportunities to collaborate. Yeah, even if you can't be with someone in the same room, in the same geographical location, we tapped onto the digital platforms to really collaborate and work together for a higher purpose and a higher mission. And I'm a real strong believer that Africa is the continent. The 21st century is the African century. And The Economist was not far from this in 2013 when they said that Africa is rising. It's rising because it is one of the world's fastest growing continents. We have a huge population that is young. 50% of the population are in the pediatric age group. And because of our context, we are compelled to find solutions that are applicable for us. And these solutions, for them to be sustainable, have to be cost effective. So many people are actually looking to Africa to find solutions. And sometimes as Africans, we are forgetting that. And as I'd highlighted earlier—
This is what you get to do when I asked you to do something.
Tracy, maybe
did I not ask you? What do you mean? What did I ask you to do?
Tracy,
what do you mean? What did I ask you to do? You clearly know what I asked you to do.
You mute, Tracy. So, as I highlighted earlier, we know that we are still battling with infectious diseases in sub-Saharan Africa. But despite that, we know we have rich resources. Poverty is still an issue, and our natural resources are still very vast, right? And we have economies that are rising. Going back to what I'd mentioned, context, understanding what is the situation. And this was a research work we were able to do with my colleagues across Africa. These are the founding members of the Pediatric Society of the African League Against Rheumatology. And we want, what is the situation in Africa when it comes to pediatric rheumatology care? In the 54 countries in our continent, it is only 10 countries that had a pediatric rheumatologist and were able to offer pediatric rheumatology. This is really important because in the backdrop of this, I was inspired to do a bit more work in my home country, Kenya, to really understand what are the challenges that our patients are facing, our colleagues are facing. And this mission of sharing the knowledge on pediatric rheumatology is a global issue. Even our colleagues in Europe lament that they don't have enough specialists to offer care to our children battling with arthritis and its associated diseases. And so then the question becomes, then what are we going to do about it? Because if we're going to wait to have 54 pediatric rheumatologists in Africa, one in every country, it's a feasible objective, but it will take a long time. And so strategies to raise the knowledge and awareness of pediatric rheumatology is key. And this is one of the key mandates of one of the groups I'm in, PAFLA, to raise the awareness in Africa. And they have achieved a lot, and I feel very honored to have been part of the team doing that. So just remember in context that it's just 10 countries and we have only about 15, 20 of us in the continent. Sometimes people can see your future before you see it. And in 2009, I was fortunate to meet a rheumatologist who was initially in America but ended up going to Canada. And she could see the need for developing the workforce in rheumatology. And she's called Professor Inés Colmeña. She's from Argentina, but now working in Canada. And she was able to connect me to McGill University in Canada, where with the support of the Canadian government, I was fortunate to get a scholarship to train and learn how to take care of our children with arthritis and its associated diseases. And I think for me, as much as I learned the skill and the art of pediatric rheumatology, I think one of the lessons that was an important life lesson was really the mentorship. Because it's been almost 8 years since I left, and they still keep in touch, walk the journey with me, give me a lot of advice, right? And support in trying to promote pediatric rheumatology in Africa. And then the other key lesson, which I also shared earlier, they taught me how to embrace seasons in life. Whether you experience winter, summer, fall, don't fight it. Just embrace it and navigate it. But this was a very foundational step in my journey to learn how to care for children. And one of the things they told me as I was coming back was, it's important to show people that these conditions exist. And therefore, collecting information to showcase to your community that these conditions are there so that we dispel the myth that they are not there. And so where I work at Aga Khan, I was able, with the support of the IT system, to develop a database. And in my first 18 months, to the surprise of many, I saw a whole spectrum. Yeah, Behçet's disease is a condition where people are always getting sores in the mouth. Vasculitis is where your natural army attacks your blood vessels, and your blood vessels are everywhere. So these children have symptoms where people can never really tie down what the issue is. Scleroderma is a condition where you have got hardening of the skin like the bark of a tree. And so you can imagine sometimes even breathing is difficult because the skin around the chest is so tight, the children can't breathe. Other conditions that are a bit more well-known are like juvenile idiopathic arthritis, arthritis in children, juvenile dermatomyositis, where the muscles are attacked and there's weakness. Lupus, is another condition that is known. And other conditions, especially to do with alignment of your bones and muscles, were some of the entities I saw. So these conditions are there in our community. There's a saying we have in medicine: the eye only sees what the mind knows. If the mind doesn't know, then the eye won't see. So I'm not an expert, for example, in heart disease. So a child with a heart disease could easily skip my attention, but my colleague who's the expert would easily detect this. Malcolm Gladwell, in his book Outliers, if you haven't read it, please get a copy, very insightful. And he talks about how many people have been able to make it in society and impact the world. And he said that we overlook just how large a role we all play, all of us. And by we, I mean society, in determining who makes it and who doesn't. And so I don't take it for granted that each of you have logged on today, because I know that by the fact that you're here and you're hearing this message, you become an ambassador for us to raise awareness for childhood arthritis, and we appreciate. And hopefully you can find other opportunities to partner with us and make this world a better place for our children battling with arthritis and its associated diseases. My next point is about talking about solutions for the. And this statement was inspired by a workshop I attended in my last year of training as a pediatrician. And this workshop was about vaccinations. And the speaker gave an example of a village somewhere in Africa, and there were some missionaries who went to that village. And they were really sad to see the young ladies walking for kilometers to fetch water. And they were thinking, oh my gosh, they're losing a lot of time. What if we're able to drill a borehole nearby? They wouldn't have to walk too far, and they can save that time and use it for other income-generating activities. So they made the decision to drill a borehole and they knew they have helped community, especially the ladies, but they were surprised that even after drilling the borehole, these young ladies were not fetching water from the borehole. And they wondered, this later realized that the young ladies preferred to walk to the river to fetch water, because that's the only way they were going to encounter young gentlemen who were potential future husbands. So drilling the borehole in the village was not going to help them in that mission. So sometimes we can have very good intent and really want to help people, but unless we involve them in the process of finding solutions to their problem, sometimes they might not buy in. And so this has inspired some work that I have been part of. And I just want to share work that was done by one of the students I have been fortunate to teach. He's called Dr. Hassan Selim. And he wanted to find out what are the experiences of the parents who care for children with arthritis at a tertiary referral hospital. And what he found is different from what has been found in different parts of the globe. They face many challenges. There are social challenges where there's a strain in the relationship between the children and their parents, between siblings, between other family members. Financial challenge, because the treatment can be expensive. Sometimes even just getting the facilities are challenged. There are normally so many investigations that need to be done, and sometimes solutions are still not found. Emotional challenges, because the frustration of sometimes knowing the diagnosis. In fact, this morning, I received a patient all the way from Uganda. For 1 month had been unwell. And my colleagues in Uganda, I don't know if they've logged on, they really did an exemplary job to keep that girl alive. Because as I read, I could see the challenges they must have encountered. And sometimes the guardians might not understand that, because for them, they want a solution. They want to know what is the answer. And sometimes when you give them the answer, they struggle with accepting what the diagnosis is. And then, of course, medical challenges, because like I said earlier, there's been not a lot of focus on the non-communicable diseases of our children, right? There's a focus on the infectious diseases, malaria, TB, HIV, but there might not be as much focus on diabetes in our children, hypertension in our children, arthritis, and cancer. And because of that, then you find that the health ecosystem has not been modeled to make the journey easier. And so there's frustration in that. And also, as you see in some more work that we did, the health workers are also frustrated because, as I said earlier, the eye only sees what the mind knows. So if they don't know, then even in their attempts to help you, they can be limited, right? So this was input from parents of children who are living and battling with the pain and disability of arthritis. We went on to now ask the health workers, what are the challenges you're facing? And one of the things that came out is that they didn't understand these arthritis diseases in children well. They felt that there was not much education on it in their training. And then they can see the pain and disability of the children, but they feel frustrated that they don't know how to help them, right? And then we asked them, in the next research paper, we asked them, okay, knowing the challenges you're facing, what solutions then do you think we can offer to help you overcome these challenges you're facing? And I have to really appreciate, there were like over 60 healthcare workers we interviewed across the Republic. They were of Kenya, nurses, community health workers, pediatricians, and general practitioners. And they gave us a lot of insights, which culminated in this framework. And they advised us that we should have like a three-pronged strategy. The first is interventions for the patient, where we can educate the patient, offer psychosocial support, but because the patient doesn't exist in isolation, not to forget the community that they are in. So to come up with outreach programs, to empower the community to know about these diseases, identify them early. I like to give the example of TB because almost everybody knows that if you cough for more than 2 weeks, you should be checked for TB. And most people know that the test for TB is not really a blood test. There should be a chest X-ray, and maybe if you're able to cough out some sputum, it can be tested. So that level of awareness is what we hope to achieve also for arthritis-associated conditions in our children. So those are the interventions they proposed for patients and the community. And then for the health worker, the interventions they proposed, like, can we offer them a step-by-step guide, an algorithm, a flow chart on what to do regarding the diagnosis? Like if you met a child with joint pain, what do you do? In diagnosis, what do you do in treatment? Again, a step-by-step approach, right? And if you're stuck, because the truth is we can't have all the resources we want. If we are stuck, then what are the steps to follow in referring them? So that was more for the clinical side, but also for education, they said, create a platform, create a program where we can identify the symptoms, we know how to communicate with our patients, and know the different management strategies. And for the health system, they proposed that if we can have an integrated clinical service, like a one-stop shop for our patients, right? Improve access to clinical care and offer better diagnostic tools. They felt that if we're able to come up with interventions in this line, we can help improve the lives of our children in the Republic of Kenya who are battling with arthritis and its associated diseases. Another favorite book of mine, Atomic Habits, by James Clear says that habits are like the atoms of our lives, that each one is a fundamental unit improve. Educational that we can a culture of how to identify these children, a culture of how to and nobody becomes expert overnight, right? I'm practicing as a pediatric rheumatologist now for 10 years, and I can tell you, I am still learning. I'm still refining. And so even as you begin this journey, if you choose to begin this journey, to not feel discouraged, it is through practice that we actually become better. And at Hope Arthritis Foundation, we are saying that we need to act and act now, because our children dealing with the burden, the pain, the disability of arthritis and its associated diseases, we need to do something now. Because the tragedy on these families, the frustrations they experience, the stigma. I once had a mother tell me she'd rather that her child had HIV and not arthritis. Because in her understanding, HIV, there was treatment, but she never heard of arthritis in children, and she did not think that there was any treatment for arthritis. And it's those kind of instances, circumstances that have motivated us at Hope Arthritis Foundation to try and find solutions now. And that brings me to one of the sessions we will be launching effective on Monday, our bootcamp. And in this bootcamp, we are going to be looking at the top 4 diseases that affect our children when it comes to the field of rheumatology. The first is juvenile idiopathic arthritis. This is chronic arthritis in children. The other one is a chronic disease of muscles in children. We call dermatomyositis. Another disease we'll be looking at will be lupus. And this is a condition where your natural army, the immune system, attacks the body. Okay. Another condition we'll be looking at is where the child's natural army attacks blood vessels. So we call that, it's a blood vessel disease, we call it vasculitis. And in this bootcamp, the key agenda here is to empower our colleagues in the health space to know the signs and symptoms of these diseases so they can detect them early. And once you've detected them, we want to empower you to know how to investigate. And once you investigate to confirm your suspicion, we're not stopping there. We'll be giving you algorithms so you know how to initiate treatment, because those children cannot all reach me, right? For many reasons. It could be geographical distance, it could be other issues of access. And we hope that this will help us in the journey to begin to conquer the burden of misdiagnosis in our children, the tragedy of unnecessary investigations where people have to spend so much money because people are not clear on how to investigate. And why are we doing all this? Because we want to prevent the burden of pain, disability, and early deaths in these children, because we do have solutions to this. And we're not just leaving you with algorithms, right? We want to empower you to be at the level of our colleagues across the globe. And we will share with you research papers, cutting edge, regarding the latest in how to diagnose these children, the latest in how to manage these children. And there'll be several virtual sessions. So this is an overview of what the bootcamp will entail. Each week, we'll be looking at a specific entity. So the first week, we'll be looking at the arthritis condition. The second week, from 8th to 14th July, we'll be looking at lupus. The third week will be looking at the dermatomyositis, which is the muscle disease. And then the fourth week will be looking at the blood vessel disease. So for each of these, every day, there's a plan. So on Monday, we will have the live lecture on how to diagnose and manage. And then on Tuesday and Wednesday, through our virtual academy, for those who are able to sign up, you will have your unique students portal, and there'll be assignments for you to work on to help you implement, put into practice what you have learned on Monday. And then on Thursday, let me go to the next slide. On Thursday, we will then review these assignments and see what your responses were. And this discussion will be important because then we understand your context, right? What you're able to do where you are with what you have. And thereafter, we will share with you the algorithm, okay, that you can use and adopt in your respective workplaces. Yeah, a logical step-by-step framework, logical step-by-step flow chart on what to do when you meet these patients in the diagnosis and management. And then on Friday, through the chat feature in our virtual academy, we will be discussing the latest research papers in the diagnosis, right? Because it's one thing to do what we can with what we have, but it's also good we know in other places what's happening, right? And then on Saturday, we will be discussing, again, this is through our chat feature in our virtual academy, the latest and pertinent research regarding the treatment, okay? And then on Sunday, we will summarize each module. And because we are all coming from different regions of the country, I know we have some participants now logged in from other parts of Africa. We are offering you a personalized call to really understand the circumstances where you're working and work with you to try and find solutions to help you implement some of the lessons we would have shared with you so that we can work together and partner together in diagnosing our children early and treating them promptly so that we reduce the burden of their pain, disability, and risk of death. And then we're going to have a bonus lecture on how to read x-rays for children with arthritis, you know, how to interpret that. And we're choosing x-rays because that's an investigation that is probably more accessible than CT scans or MRIs or ultrasound. And they are very, very useful. And of course, on the 29th of August, we will have a virtual graduation ceremony for all those who will be able to join us in our bootcamp. And this is an approach that we will be launching, and we have developed this at Hope Arthritis. It's a systematic approach in dealing and managing our children with rheumatology, yeah? And we are calling it the S-diet approach. And this is a phenomenon concept even for other chronic diseases, diabetes, hypertension, cancer, still applies. And even if you're not a health worker, if you've logged on and you're not a health worker, if you have this with you, if you have a loved one who has a chronic illness, and you keep this in mind when you go for the clinic visits, you will pretty much cover all the key areas. So the S stands for syndromic identification. And for each of the modules we will be having, we'll be looking at what are the key symptoms you should identify. And because our diseases affect many organs, we will then be empowering you to know how to identify which organ or which system is affected. And because these are chronic conditions, another important thing is to understand the patient journey, because before they reach you, they must have gone somewhere to try an intervention. So it's important you get that information. What intervention have they tried and how did they respond to this intervention? So that's the S. And then the DIA looks at the diagnostic determination, right? And you want to diagnose the primary problem, right? And in addition to that, you want to confirm which other organ might be having a complication. And not to forget, in the spirit of holistic care, which other psychosocial factors are the patients navigating, okay? And then the T stands for treatment. And when you're treating, we want to treat the primary disease. It's important to treat the organs that are affected. And because these are chronic conditions, remember there are potential drug complications. So it's important that we also treat these drug complications. And not to forget that always remember to address the psychosocial issues of the patient. So for each of the modules, we will be delving into this approach, to help develop a systematic approach in managing these patients. But we also have bonuses, right? And we will have diagnostic sheets for the top 4 conditions I've discussed. I shared with you, we will have management algorithms for these conditions we've discussed. You will have access to our virtual support group where we have got challenging cases. You're welcome to share them there, and we brainstorm and we see how to support you. Access to our YouTube channel for educational material. And of course, a self-assessment tool, so you can gauge yourself and what are your educational needs. And like I said, a platform to discuss challenging cases. Tracy, you'll just cross-check the audio. We'll request that you please put your mic on mute. We are not working in isolation. We exist in an ecosystem. And these are partners that I have had the privilege to work with through my networks in PAFLA, through my networks as a member of the Kenya Pediatric Association. And we continue looking forward to building our partnerships. But we have other educational products. I'm a real strong believer that in medicine, taking the history from the patient, listening to their story, and examining them thoroughly, head to toe, forms 80% of the information you need to discover what is the health problem. And so that's the essence of our ABC's Pediatric Rheumatology Masterclass. We just focus on sharing the skills in how to take a history and examine. And we will be having our next masterclass in August 2024. And that is a program that those who would want to, they would then see how to either sponsor themselves or get somebody to support them to join this session. And I know some of those who've been attending this masterclass have also logged in today. Thank you. Dr. Masi, I appreciate you for participating in this masterclass. The next 2 programs are actually sponsored, and so please look out for them. The first one is the GIA Masterclass for Parents. And here we have a global faculty that is already working around the clock on virtual educational sessions for parents and guardians of children with arthritis. And this one will be actually September 7th and September 14th and September 21st. So please look out for this. At the end of this, Tracy will share with you a link to join our virtual community so you can get updates on this. And this is a sponsored session. And so when it comes, please spread the word so people can log in. And then we will also have another sponsored session in October 2024. Here now we are focusing on the health worker. And again, we have a global faculty that includes not just the health workers, but patient representatives. We also have the nursing fraternity involved. We have the physiotherapists and occupational therapists involved. They all form part of the team that will be sharing knowledge. All this is with the agenda of raising awareness because we believe that awareness is the first step in advocacy. We're having our first bootcamp, cohort 1, starting July 1st. So those who'd like to join in at the end of this session, Tracy will be sharing details of how you can join. But if it is not possible to join this cohort in July, our next cohort will be in November 2024. And we look forward to hosting those who would be willing to join. This one again would be self-sponsored. So if you're interested, you can be able to pay for yourself or get a sponsor to support you. And we will be launching a new educational program in the first quarter of 2025. And this will be an expert level course in pediatric rheumatology, where in addition to what we're offering in the bootcamp, where we are empowering you to diagnose and initiate management, in the expert level course, we'll empower you now not only to diagnose and initiate management, but how do you do the follow-up of these children, because these are chronic conditions. Please feel free to visit our website. And in a special way, I want to thank Mr. Collins Munene and the Diligence Company that have really been working around the clock to develop our website, make sure it is user-friendly for those who are physically challenged, and also working on our virtual academy. Thank you so much, Collins. And if you have any queries, you can send us an email on info@hepatitisfoundation.com. I'm coming to the end, and I want to share a quote from Nobel Peace Prize winner from our home country, Kenya, a lady whom I admire, and I think she shared a lot of wisdom. And she said, in the course of history, there comes a time when humanity is called to shift to a new level of consciousness, to reach a higher moral ground, a time when we have to just shed our fear and give hope to each other. And that time is now. And you remember the case I shared with you in the beginning of this young girl who came from a northern city in my home country at the border of Kenya and Somalia, and she had arthritis of the knee. And the solution that the family was being offered was an amputation. But they were able to reach our facility, courtesy of colleagues in Kijabe Hospital who knew that this was arthritis. They might not have known how to treat it, but they knew the treatment was not an amputation. So she made it to our facility. We started treatment. We were able to help her recover from her arthritis, and we saved her from having her leg amputated. And now she goes to school. She doesn't even need crutches, and she's doing very well. So knowledge, my dear participants, is power. And information is extremely liberating. And education is the premise of progress in every society, in every family. At Hepatitis Foundation, we are committed to empower the communities we serve with the knowledge to recognize these children, the knowledge to know how they should be managed, so that we can be partners in advocating for our children. I really want to say thank you to the patients who I encounter who inspire me to be a better healthcare provider. I would not be here if it was not for my mentors. And I see also the students I teach, the younger colleagues, my mentees, they are like reverse mentors and teachers in my professional journey. Of course, my family and friends. And at Hepatitis Foundation is a whole team that has been working with me now for almost a year. The Hepatitis Foundation board and our program coordinator, Ms. Tracy, Mr. Anthony Kuria and Custom Media House that have been helping us optimize our digital presence, Mr. Collins Munene and the Diligence Company that have been working around the clock for in developing our website, developing our virtual academy. And, before I could even reach out to the hepatitis board or reach out to Mr. Anthony and Media House or Mr. Collins, there's another team that helped me develop myself. I want to thank Ms. Edith Sidondo and Prophet Acumen for helping us come up with a business plan for arthritis. And I was able to meet them through the network of Dr. Patricia Murugami and the Breakthrough Leadership Transformation Group. Thank you, Dr. Patricia Murugami. And Ms. Beatrice Sidao, who is our brand consultant, and ultimately all our beneficiaries and benefactors who support us. That's the end of my presentation. Thank you so much for your time, for your patience, for listening. I now invite Ms. Tracy to take over. You're muted, Tracy.
Thank you so much, Dr. Angela, for that wonderful presentation. It was really articulate and detailed. And so I'd like to take you through the next session where I'll just quickly show you the programs, highlight the programs, the upcoming programs for Hope Arthritis Foundation. So my name is Tracy Mwiti, as you've heard. And the first program that I'm going to introduce you to is ABC Masterclass. So we already had our first cohort last year and the second cohort as well. So now we are going into the third cohort, which will be happening on 6th August 2024. So the ABC Masterclass is dubbed ABCs of Initial Diagnosis in Pediatric Rheumatology Masterclass, which equips the participants with history taking and the skills that they need to make initial diagnosis in pediatric rheumatology cases. And the target audience for this are the health workers. So in case you missed last year's masterclass, you have a chance to join this one happening on 6th August. Then we have the JIA masterclass that Dr. Angela has already talked about. The first one will be for guardians happening on 14th and 21st September. It's a sponsored masterclass, so make sure you spread the word. This is for the guardians. We want to empower them to be able to take care of children that are suffering with arthritis. So we'll be focusing on JIA, juvenile idiopathic arthritis. Then we also have a JIA masterclass that is sponsored. This one, the target is healthcare workers. So as you empower guardians, you also empower the healthcare workers that are going to be treating them. This one is happening in October 2024. So be on the lookout for the exact date for this masterclass. We shall be sharing this on the website as well as on our social media pages. Then we have the Rheuma Fun Zone. This is a very exciting and interesting program. It's unique because it focuses on the patients. So we decided to also have a program for the patients. So this is where the children come together. They learn about their disease, they play, they have fun and games and all that. So it's a very interactive workshop. So if you know a parent who has a child with any rheumatic disease, this would be a very great opportunity for them. The date is still yet to be determined, so look out for this. We'll be sharing more information about Rheuma Fun Zone on our website as well as our social media pages. And we also have a community, so be on the lookout. Then the next one is the bootcamp, which Dr. Angela has already mentioned in detail. She has talked about the program, the schedule, what will be covered in this bootcamp. The target audience is the healthcare workers. And this one is happening from 1st July. So we only have 2 days to the bootcamp. If you are interested in this program, it's not too late to sign up. So please make a point of signing up. So you probably are wondering what are the cost implications for this program. As she said, we are having 4 modules. And those are the modules. If you decide to pick one module, for example, juvenile idiopathic arthritis JIA, the cost for the module will be $300 US, which is equivalent to 40,200. You can also decide you want only to focus on juvenile SLE or focus on dermatomyositis. So the choice is yours. But the good news is, if you decide to take up all the 4 modules, there's a great discount. So you'll be getting all the 4 modules at US dollars $9.99, equivalent to Kenyan shillings 133,866. So feel free to reach out in case you want further information about this bootcamp, but I'll also share a link for you to register. If you have maybe an organization or you're part of an organization that can sponsor health workers to attend this bootcamp, that will be really great. So like Dr. Angela has mentioned, the bootcamp is beginning on 1st July, and every week I will be focusing on a different condition. Week 1, JIA, week 2, juvenile SLE, week 3, dermatomyositis, week 4, vasculitis. So in case you weren't maybe prepared for this cohort, we have another cohort coming up in November. So maybe you can start making preparations for that, and we will see you in November. So how to sign up? There is a link which I'm going to share on the chat in a few. When you click that link, it will lead you to the website where you're going to sign up. And after signing up, it will automatically show you the payment details where you're to pay. We have M-Pesa. We also have MasterCard. We have PayPal. I'm sure you will find the right and suitable payment plan. So in addition to that, we invite you and encourage you to join our community. We are on all social media pages. We have LinkedIn, we have Instagram, we have Facebook, TikTok, Twitter, and WhatsApp community. So I'm going to share all these links shortly, but mostly I'd encourage you to join the WhatsApp community. That's where we do most of our updates, regular and prompt updates. I think some of you are already in that group. So that is one way that you can stay updated and abreast of everything that we are doing. We also have other ways that you can reach us. If you're not a social media person, you can call us on our phone numbers indicated on the screen. We also have a WhatsApp number if you prefer to chat on WhatsApp. We have an email address, info@hopearthritisfoundation.com, and also our website. Yeah, so I welcome questions. In case anyone has a question to either me or Dr. Angela, feel free to use the raise hand icon.
Thank you so much, Tracy.
Any questions?
So we're opening the floor for any comments, any queries, any feedback. I want to appreciate our colleagues from across Africa. I see Dr. Alexandra joined. I noted that Dr. Ayo from Nigeria joined. So anyone with any question or comment or observation, this is a safe space. You're free to
Dr. Angela, maybe we can do one more icebreaker.
Yes. Yes,
right.
Please.
Okay, I'm sharing the link shortly.
Okay.
You can also use the chat for questions.
Yeah, I can see, actually, as you're doing that, let me just read. I can see comments from, so we see Dr. Dixon. Oh, thank you, Dr. Dixon from Uganda. Thank you for joining. And thank you for being an ambassador for pediatric rheumatology patients in Uganda. Thank you for that. And then Aura from Kenya has clapped. Thank you. Dr. Piero, thank you so much. Merci beaucoup. I'm not sure whether this is Dr. Piero from Cameroon, but thank you. Collins, our website designer and manager. Thank you, Collins. We appreciate you for all you've done for Hope Arthritis. Rasi, one of our students. For the masterclass, thank you, Mercy. And for all the great work you do serving the children of Kenya. Leah also, thank you so much for joining. Okay, Tracy, over to you.
All right, I have shared the link on the chat, so kindly click the link and tell us which city you are joining us from. Nairobi. Kigali, Rwanda, thank you. You can see we have 17 participants. London, awesome.
This is nice. Thank you, everyone. Any more responses?
Johannesburg, great.
Thank you. Thank you to our colleagues from South Africa, from London, from Kigali, and Nairobi. Thank you so much. We appreciate you for joining us on this Friday evening.
Okay, so we move to the next question.
Mhm.
One word to describe the session. Inspiring. Empowering. Any more responses?
I see in the chat also there are some who are typing informative. Bilha, thank you for that. Leonard Award says educative. Thank you so much. Lassie says thank you for this learning and mentorship. Okay.
Thank you. Awesome.
It's inspiring. Wow.
Mm.
Okay. And please, we're also looking forward to your feedback on how we can improve. So don't shy away from sharing insights on what you think we can do better. Yeah. Yeah, thank you, Mercy. Inspiring, empowering. So Tracy, this is the last one, I think. Yeah, how do you feel today?
I think we have one more.
Thank you.
What was your key takeaway? So I'm sure most of us did not have a chance to use the Mentimeter app for the feedback. So I'm sharing a link to a Google form to give us detailed feedback. So please, if you're able to do that right now, you can do so. If not, make a note, make a point to do it after this session.
Great. Thank you, Tracy. And so on behalf of Hope Arthritis Foundation, we want to appreciate each and every one of you for logging in, for taking time. We humbly plead that collaborate with us in sharing with the community that children do get arthritis. Yeah. So please partner with us in that. And if there are programs you feel that work for you, don't hesitate to reach out and we see how to enroll you. And I hope to see some of you in our bootcamp beginning effective 1st of July. So that is it. And Tracy, maybe you can close and then we will continue our deliberations in other platforms. Maybe you'll share the link for the WhatsApp group. So those who are interested in join. So we have a WhatsApp community, and feel free to join in. The link is in the chat. And there we share a lot of updates of the activities that we are doing. Those that are sponsored, those that would require your own sponsorship. We have a vast spectrum. So whatever works for you, works for us. Our agenda is just to lobby for our children with arthritis. So on that note, we want to wish you all a restful evening and a splendid weekend ahead. And we continue looking forward to partnering with each and every one of you in our mission. Thank you so much, everyone, and good night.
Bye-bye.
All right, good night. Bye-bye. Merci, Dr. Traoré. Merci beaucoup. Merci pour votre attention. Merci. Thank you, everybody. Thank you, Tracy. Oh, Lydia. Hey. Thank you so much for joining. You're free to speak, Lydia. You're feeling shy. You're muted. You're muted.
Mute.
Yeah, now we can hear you.
Oh, yeah. Thank you so much. Although I've joined you a bit late,
Yeah.
but we really appreciate what you're doing.
Thank
And
you.
you're ready to soldier on this journey for the sake of our children.
Yeah.
I think at the time or Billy, because you guys are two hours ahead. So I got mixed up. And that's the reason why I got in late, but we are together in this journey.
Thank you.
And we do really, really appreciate it.